a benefits consultant with David Insurance. Just wanted to take a few minutes this morning. Hopefully I'm going to keep it under 15 to 20 minutes for you, but wanted to bring the 100 plus space in that fully insured world some insight into what's going on with your renewal and what your options are moving forward. So real quickly, just talking about the current state of where we're at. Obviously, COVID has played a big part into what's going on. Everyone thought the renewals were going to come in really good because their employees haven't been utilizing the health plan. And what we're seeing is that's not typically the case. So people have put off elective surgeries. So insurance companies are saying that more elective surgeries are going to happen next year. We're not quite sure how much the hospitals are going to charge because the hospitals are hurting right now. They didn't have the revenue that they typically do, and they all operate off of what they expect. So this year being unusual, to say the least, that's kind of why some of the renewals are coming in as high as they are. The other thing is the insurance company profit. So some of you probably received a rebate, right? And then you kind of say, well, again, how are they going to recoup that money? So they're going to recoup that money in renewals, but they also have to account for medical trend. And what we always hear is, well, it's medical trend, but what does that actually mean? And how is medical trend important to me? So when insurance companies go to negotiating and contracts with the providers or the hospital systems every like 3 to 5 years, that medical trend and that contract says that the insurance company has to pay X percent more every year during that contract period. So if it's 5 to 10%, right, the insurance company already knows that 5 to 10% is going to go out the door compared to last year. So they then turn around and put that into your premiums. And the other false assumption out there is you're with a carrier that has the best discounts. Okay, and then I just want to real quickly give you an example of that. So if I walk onto a car dealership and I say, I'm going to purchase a car today, and they say, that's great, you're going to get 80% off. That sounds great. And then I say, okay, I want to purchase this car. And they say, okay, well, the starting price of that car is $1 million. Well, that discount really didn't do much for me because I could go down the street at another dealership and pay less than what I did here. The reason I bring that up is a lot of the carriers talk about PPO discounts or HMO discounts that they have, and they provide the deepest discounts. But what people don't know is that nobody holds the providers and the hospitals accountable to what the starting price is. So if that isn't there, what is the end result for your employees in the fully insured world, right? Because you're paying a premium, the employees use the plan. So your employees are paying more for their same services. So we're going to talk about that here. So medical pricing. So why is this slide relevant? So in Wisconsin and Illinois, we pay the same. So if somebody goes in and they're on Medicare, they pay about $100 for a service, right? We wish that was the real price, but I'm using it as simplicity numbers. So if somebody in Medicare can pay $100 for a service, but you and your employees at private payers go in and you have that same service done, we're going to pay anywhere between $275 to $300 for that same service. And they say, well, it's because we don't make enough money on Medicare. Well, in reality, right, they should, because that's what the price is. But the problem is they have a lot of middlemen, right? How many people are in that hospital system that are doing billing and administrative work, and who's paying for the overhead of the building and all of those things. So it's really not the providers that jack up the price, it's the facilities that your employees are going to. So the BUCAs, right, is what we're trying to kind of say, they've dominated the space for so long. They say they have the deepest discounts. This is what ends up on your spreadsheet every year. You might have a couple smaller regional carriers that are also on your spreadsheet, but nobody wants to talk about the real issue with healthcare and how to provide your employees better quality of care for lower costs. So let's look at this real quick. So my goal is to help employers reduce their healthcare spend, improve the quality of care for their employees, improve the employee experience because they're being assisted while trying to navigate care. So a lot of employees, unfortunately, just go wherever their doctor tells them to go. Well, you see your doctor in a hospital system, they're going to tell you to go downstairs and get lab work done. They're going to tell you to go downstairs and get a CAT scan done. They're going to tell you that you need to have surgery with their surgeons. So who is on your employee's side when they're seeking care? So we want to help guide members to the right providers. We're going to talk about that in a second. We also partner with independent TPAs that will actually be able to intervene and provide concierge services to your employees before they go seek care. So if for some reason an MRI pops up in the claims history of your company, right, they might get an outbound call or make a call themselves to, where should I go have surgery? Where are the best orthopedics or the best surgeons? And so we want to say that we're going to influence that in real time. The other thing that we want to talk about is engaging, right? So to prevent future risk. So if you have a lot of diabetics or overweight, right? So what type of programs can we put in place to engage them to prevent future risk? And then ultimately, right, we're going to save on healthcare costs. So this is a real life example of a knee replacement shopping in Illinois. And you're going to see that one of the larger facilities, University of Illinois Hospital here, charges about $118,000 for the knee surgeries that they do. And in this case, they only did 11. And their quality of care is in the bottom 15%. So you're going to pay the most for the surgery, but you're going to have a lower quality doctor than if you went to Memorial Medical Center in Springfield, who actually did 36 surgeries. They only charge $60,000, and they rank in the top 65% as far as quality goes. So if I'm an employee or a patient and I'm trying to seek care, where do I want to go, right? So if I'm in a fully insured plan, like you might be, the employee is saving money and they're getting a better quality of care. Or when you start moving into the level funded independent TPA model, which is where you should be, then you as the plan are going to save about $60,000 on that same surgery. So let's talk about how this works. If you're in a fully insured plan right now, you're paying premiums that go out the door, whether your employees use the plan or not. In a level funded product, which a lot of you have probably been told you either need to be fully insured or you can be self-insured, right? Well, there's independent TPA parties or partners that we have that offer a level funded product. So you might not even be familiar with level funded because a lot of carriers don't even allow this to happen in the 100+ space. So in a level funded product, you are basically going to have your administrative cost bucket and you have your claims bucket. And that claims bucket is what we want to look at on a monthly basis. And your vendor partner will help intervene throughout the course of the year with these qualities of care. And if you have money left over in that claims bucket at the end of the year, right, you get that money back. So you have this self-funded alternative funding mechanism of a plan where you don't take the full responsibility of a self-funded plan. And that's why a lot of employers don't want to move to that. So when you start looking at the savings here, right, we can get you probably from 10 to 15% of where you are currently. How do we do that? So here's some of the things, right? Billing errors is a big one of them. So right now, the BUCAs, who I referenced earlier, their contracts say that they are going to pay their discount based off of whatever's billed. Well, a lot of bills have errors, right? So 80% of bills over $400 have some type of billing error. So billing errors is going to be one of them. International or RX manufacturer assistance. So prescription drugs are where it's at, right? And there's a lot of different services out there that once we get some data on your employees, we can say, okay, this one makes sense, or both of them make sense, and combine that and help your employees save money and your plan save money. Member advocacy is the concierge service I talked about. So a lot of times if that MRI comes up and there is a knee replacement that needs to be done, where are those people going? And our vendor partner helps shop that for them. So they're going to the highest quality, lowest cost facility. And a lot of times when they're doing that, the employer is waiving their deductible. Wait, an employee can go have a knee surgery done and not have a deductible? Because the plan could potentially save $60,000 in the example previously, an employer is more than happy to cover a $2,500 deductible for that employee, so the employee goes to the right facility. Wow, that talk about good healthcare and a good health insurance plan is giving your employees the plans that they want with higher quality. That makes you an employer of choice, hands down, right? Other things, right? We talk about, is there marketplace coverage? Where does it make sense? Are they Medicare eligible? Us at David Insurance actually help with this too, if you need employees that are need a little bit more guidance on Medicare options. And then obviously we're all familiar with telemedicine services now that the pandemic has hit, so I don't want to go too much into that. As we start kind of going through this, right, we talk about how much noise do you want from your employees? What are the things that you want to accomplish? If you're just looking to save some money, provide some guidance, right, in year one, this is your option all day long. When you start getting into some of these other things, right, there might be a little bit of noise from an employee until they understand what the health plan looks like, just because they've never had to call somebody before. They've never been told that they should go to this facility or this facility. They've always just gone down the street or asked Uncle Jim who they went to. So there's a lot of things that we can do and get creative in order to help your plan and provide that better member experience for your employees. Here's a couple examples. There are some examples here: 52, 110 employees, 75. Right? This is a couple years savings, but here's an example of an engineering firm, 130 people, right? Saving $324,000 just by putting in a prepay cash service, okay? Another one here, shipping, 155 employees, save $642,000. So the claims audit, so that billing review, international prescription outsourcing, and they took some people off of the Medicare or off the plan and put them on Medicare. So there's things that we can do based off of your census, your claims data that we can look at. And as far as gathering claims data, that's a whole nother topic, right? A lot of times you've probably been told you need to fill out FormFire or Easy Apps or something along those lines. And in reality, there are different ways that we can pull data that doesn't make employees fill out questionnaires. It makes it less invasive and a lot less time consuming. So we're able to pull that, get it for you, and not have to really burden the employees too much to get their claims data. So really, you know, we're creating savings for you, 10 to 15% on average. For every 500 employees that you have, we average about $1 million savings. So if you think about that, right, if you have 250, or might be somewhere close to $500,000 in savings. So you can kind of do the math with whatever your employee count is, but ultimately we're reducing your spend, we're reducing the employee out of pocket, they're getting a higher quality of care, and we're generating cash flow for you as the employer to use in ROI opportunities, capital expense, other things. You might just want free cash flow on hand because 2021 might be unpredictable as we move forward during the pandemic. So there's lots of things that we can do. I'd really love to have the opportunity to talk with you further if this makes sense and you'd like to look at options. If it's not something that's right for you this year, obviously Q1, Q2 is a good time to start talking about strategies moving into 2022. So I appreciate your time. Have a great day.